The other options are biologics. And there are some biologics that are available on the market, but the problem is many of them are difficult to administer. They need to be injected. They can have side effects, and they also have stability issues. If you look, for example, at the MS drug, Agonist by Biogen, that needs to be injected. It's a very large dose. It also is not stable, so it requires refrigeration and special handling. So these are the major issues with biologics, and we've dealt with all of these issues as we develop Cobroxin. What Cobroxin does is it creates a new category as a crossover between stage 1 and stage 3. A new stage 2 drug for the treatment of pain that is over-the-counter, completely available, non-narcotic, non-opiate, non-addictive, with really no discernible side effects. And that's what he said. In the last clinical study, it was shown to be clinically superior to morphine. It lasted 4 times longer than morphine. And because the dose is so small, you're talking anywhere from 40 to 50 micrograms per milliliter. On a molecular basis, it's 600 times more potent than morphine, because you need to take a lot of morphine to have benefit. This is what we call a crossover product. It's an over-the-counter product, but it addresses what is now a prescription drug place. So we have $6 billion spent on over-the-counter painkillers, $14 billion spent on prescription painkillers, and here we have a new category, a new OTC category that's a crossover that addresses as much as a $20 billion marketplace. So how does it work? I'm not going to go too deep into this. I don't know how many neurologists are in the room? Okay, I don't want to bore you with too many neurologic details. But understand that these peptides, as I said, are very specific. They bind to receptors in the end of the nerve. Now, the major receptor it binds to is the nicotinic acetylcholine receptor. In fact, only one subtype of the nicotinic acetylcholine receptor, called the alpha-7 subtype, which is only found in the body, in the central nervous system, and on white blood cells. When it binds to those nerves, it regulates the nerve pathway, regulates how much energy can go through the nerve. So it's not an agonist, it's not an antagonist, it's a modulating agent. So pain is a hyperreaction, it's a strong reaction, and it calms it down. So when you take Cobroxin, you still have sensation, you can still feel pressure and heat, but the pain goes away. We also found that it binds inside the brain in the parafascicular nucleus, which is the part of the brain that processes pain. And so it tells your body not to feel pain as well. Now, this is important too. You still have all the sensations. So I remember when I was in high school, I had a friend that sprained his ankle, and we had to go to a dance that night, and he took a bunch of drugs, and he goes, "I feel great," and all night he danced. I said, "Are you nuts? You still have a sprained ankle, you don't want to dance." So he goes, "I feel fine." Well, the next day, his ankle, his foot, his lower leg was swelled up like a football. He was in so much pain, and nothing was going to work for him. It took him months to really recover from that. Well, when you take Cobroxin, you still feel that there's something wrong. You know there's a problem. You're going to make sure that you don't overdo it if it's a traumatic injury, but you can function. The pain goes away. So this is just looking at the nerve and the synapse between the nerves. Just as a quick lesson on neurology, for the most part, nerves don't touch. There's a separation called a synapse. For a nerve wave to go from one nerve to the next, from one neuron to the next, it sends a neurotransmitter across the synapse. For the most part, in the central nervous system, that neurotransmitter is called acetylcholine. It goes from one nerve, the presynaptic nerve, to the postsynaptic nerve and opens up that nerve channel. Well, when our drug is in the system, it modulates how much of a wave can go from one nerve to the next. It shortens it, it truncates the wave so that anything that's a hyperreaction can occur, like pain. So who's going to use Cobroxin? Well, certainly people without healthcare insurance that don't have access to the prescription medication, people without prescription coverage, people afraid of side effects, drug side effects. I know I think for a living. I don't want to have to take drugs that modify the way I think, to make me look dopey or a medicine head. And the Cobroxin has none of those side effects. People subject to drug screening at work who can't use opiate products and narcotic products. People for whom the over-the-counter products stopped working or they have to take tons of Advil or Tylenol on a daily basis, and it's just not doing it for them anymore. They're about to go to prescriptions anyway. Here's another over-the-counter product that they can try. And then doctors are afraid to prescribe opiates. Pain clinics are being shut down every day because they're basically just legalized drug pushers. People come there for the drugs that they're addicted to in some way, shape, or form. And a lot of doctors are afraid of being accused of being drug pushers. And so here's an opportunity for those doctors to give a recommendation away from the prescription products. The product is available in an oral spray. This is the oral spray. It's a 1 ounce oral spray. It lasts about a month of normal use. You spray it 2-3 times, 2-3 squirts in your mouth. It gets absorbed through the buccal mucosa 3 or 4 times a day. Now the wonder of this is, remember I told you that a lot of the drugs have a ceiling effect, where over time the body grows resistant to the drug? This is the exact opposite effect. Because the peptide binds to the neuron, binds the receptor, in something called induced fit, it literally changes the shape of the receptor over time. And so the body grows more and more sensitive to the drug over time. So the more you take, the less you need, which is the worst thing I can say to the marketing department, but it's fantastic because instead of having to take more and more of the drug over time, you can take less and less and get the same benefits. So this is really about a month's supply, but over time, as you take the product, you're going to use less and less, and it's going to last a lot longer. The retail price is somewhere around $19 for the oral spray and about $20, $21 for the topical gel. Now the way it gets absorbed, the topical gel is best used anywhere there's not a lot of muscle or fat. That's your hands, your wrists, your knees, your ankles. If you're thin enough but not muscular enough, your lower back, head, and neck, you can use the gel as well. And we've seen some great testimonials on the use of the topical gel. But for someone who has deep muscle pain, has chronic back pain, head and neck pain, migraines, you should be using the oral product, which is systemic and affects pain all over the body. Now, aside from our stage 2 product, we also announced last year the creation of a stage 3 drug, Nyloxin RX. And this is a much stronger version of Cobroxin. This is going to be available as a prescription product in pharmacies and hospitals. We're conducting 2 clinical studies this year to support its use. Technically, it's not a scheduled drug, so it doesn't require a prescription. We're calling it RX, we're calling it a prescription product, because if you have stage 3 pain, you should be under a physician's care. Because you have enough pain that you should figure out what's going on, what's wrong with you, how the pain can be treated. But this is going to take off the issue with the pain. Now, if you start to look at the market for stage 3 drugs, oxycodone, morphine, and fentanyl, and this is another $14 billion marketplace that we're in. We have also announced Nyloxin OTC. This is an over-the-counter version of Nyloxin. It's very similar to Cobroxin, but we're branding it for international use. So Nyloxin RX and Nyloxin OTC will be in all the international markets, whereas Cobroxin is going to be in the U.S. along with Nyloxin RX. It creates international brand recognition. We've already begun international registration in Europe, Canada, Brazil, and Colombia, and we'll be announcing other countries in the next couple of weeks. So for more information, we have a great website at nutrapharma.com. Also websites at cobroxin.com and nyloxin.com. I'd be happy to take some questions.